Hi, I'm Dr. Frank Gerges from Sinus and Allergy Wellness Center of North Scottsdale.
Recently, we had a patient that asked a question about the open procedure. And how is the open procedure helping patients with chronic sinus infections? The unique thing about the open procedure is that it's different for each and every person. So thus we use technology, we'll use a CAT scan, we'll use nasal endoscopies just to get a real good idea and a good feel for what's going on inside your nose causing problems. So oftentimes if the nasal anatomy is abnormal, the nasal function will be abnormal. So if we can correct the nasal anatomy even to a minimal degree, we can actually improve nasal function. So the open procedure could be block sinuses. Well, let's open those sinuses with a very conservative technique like the balloon sinuplasty. If the breathing pathway through the nose is obstructed, patients aren't getting good quality of sleep. Well, if we reduce turbinates inside the nasal cavity, we can enhance their sleep at nighttime. So thus patients will feel that they're getting a better quality sleep and their nose is open. If their patients complain of drainage inside their nose, well, that could be coming from a contact point inside the nose. For example, the septum that's nice and straight inside the nose in an ideal situation, most times is not nice and straight. But if the septum deviates to a position, it actually comes into contact with a structure called a turbinate on the outside of the nose, well, that contact point could be causing drainage. And in those scenarios, sometimes patients will have headaches, but oftentimes they may have no sinus problems. They may not have headaches, but their chief complaint is drainage. Well, if we create an opening inside that contact point and reduce that obstruction, we can resolve drainage inside the nasal cavity. Finally, smell. Oftentimes patients will say, well, I don't have COVID or I never had COVID, but my smell's not ideal. Smells may not be ideal because getting airflow to the roof of the nose where the small little olfactory nerves or the smell nerves are inside the nasal cavity may be blocked. So if we can reduce that blockage, open up the nasal cavity, we can enhance smell. So do you need the sinus open procedure? Maybe you do. And we here at the Sinus Allergy Wellness Center will diagnose that and treat it effectively for you. Thank you.